Hepatitis B and C. This is what everyone should be aware of. As the name suggests, it is a virus which causes hepatitis or liver inflammation. So there are two common viruses, B and C, which cause chronic inflammation of the liver. 1 to 3% of the world population is infected with these viruses, and most of these people are not aware they have the infection. Of course, some areas the risks of having infection with hepatitis B and C is much high. For example, Central Asia, China, Russia, Southeast Asia, African countries, Central America, maybe Japan. These places have very high risk of people with hepatitis B and C infection. In general, the World Health Organization or the WHO recommends that every individual should at least check for hepatitis B and C once in their lifetime. How does hepatitis B and C affect the liver? These are infections which you can get through blood transfusions, through sexual transmission. Mothers can transmit it to their newborn. People can get infections through needle stick injuries or through various medical procedures which have not been clean. There are many ways of hepatitis B and C getting transmitted to you. You will never know whether you're infected. The interesting thing is that people remain asymptomatic or without symptoms for prolonged periods of times, which can go into a few decades. So 20, 30 years, you will not have any symptom even if you have hepatitis B or C. The other interesting thing is that if you detect it early, and for that you just need a simple blood test, you can actually treat it. Hepatitis C can actually be treated with just 3 months of medications. Medications are so good that 99.9% of patients who get treatment for hepatitis C for 3 months get cured. And you would not understand how important this is for not just for you, but for the medical community as well. Treating hepatitis C prevents you from developing advanced forms of liver disease such as liver cirrhosis. Treating hepatitis C prevents you from developing liver cancer. Even hepatitis B is extremely important. In fact, the number of people with hepatitis B is much, much more than hepatitis C. And again, there is a simple blood test for hepatitis B. Of course, we can't treat hepatitis B with few months of treatment, but there are excellent drugs which you can take for extended periods of time for several years. This can control the hepatitis B virus, keep the levels to near negligible values, and prevent progression of liver disease, once again prevent development of cirrhosis and liver cancer. So please don't disregard this information. Make sure that you have tested for hepatitis B and C at least once in your lifetime.